If arteries could speak, they would never shout or cause sudden pain at first. Instead, they would whisper through years of subtle changes: slightly higher blood pressure, colder hands and feet, slower walking pace, reduced stamina, poorer sleep, declining sexual performance, and mild breathlessness that most seniors dismiss as just age. By the time a heart attack or stroke occurs, the damage has usually been building silently for decades. That is why when people talk about unclogging arteries, it's important to understand the biology clearly, especially after 60. Arteries don't clog like kitchen pipes overnight, they gradually stiffen, inflame, narrow, and lose their ability to relax. The good news, and this is backed by decades of cardiovascular research, is that even aging arteries remain biologically active and responsive to the right signals, particularly nutritional signals. From a medical perspective, no pill, no supplement, and no single ingredient can magically dissolve plaque overnight, but there is one meal pattern that consistently shows improvement in arterial health, plaque stability, inflammation reduction, endothelial function, and long-term survival, even in seniors. That meal is a plant-forward Mediterranean-style meal centered around extra virgin olive oil, vegetables, legumes, whole grains, and optional fatty fish, and its benefits are among the most extensively studied in heart disease research. To understand why this meal works, we must first understand what arterial plaque really is. Plaque is not just fat stuck inside arteries. It is a living inflammatory structure composed of oxidized LDL cholesterol, immune cells like macrophages, calcium deposits, fibrous tissue, and inflammatory chemicals. The greatest danger is not how much plaque exists, but how unstable and inflamed it becomes. When plaque is inflamed, it can rupture suddenly, forming a clot that blocks blood flow and causes heart attacks or strokes. Therefore, the real goal of artery health is not aggressively scraping plaque away, but calming inflammation, reducing oxidative stress, improving nitric oxide signaling, restoring endothelial function, and stabilizing plaque over time. This is exactly where the Mediterranean-style meal excels, and this is why cardiology journals consistently highlight it as one of the most powerful non-pharmacological interventions for cardiovascular aging. Large, long-term population studies following tens of thousands of people over many years show that those who regularly eat Mediterranean-style meals experience significantly lower rates of heart attacks, strokes, sudden cardiac death, and heart failure, even when their cholesterol numbers are not dramatically different from others. This tells us the benefit goes far beyond cholesterol alone and directly affects arterial biology. At the center of this meal is extra virgin olive oil, which functions less like a fat and more like vascular medicine. Extra virgin olive oil contains unique polyphenols such as oleuropein and hydroxytyrosol that protect LDL cholesterol from oxidation, a key step in plaque formation. Oxidized LDL is what triggers immune cells to invade artery walls and initiate inflammation. By reducing LDL oxidation, olive oil directly interrupts plaque progression. Clinical studies show that olive oil improves endothelial function, meaning arteries regain the ability to relax, widen, and respond to blood flow demands. This lowers blood pressure, improves circulation to the heart, brain, kidneys, legs, and even the penis, and reduces mechanical stress on artery walls. In seniors, endothelial dysfunction is one of the earliest and most important markers of vascular aging, and olive oil directly targets this process. Vegetables form the second critical component of this meal, particularly leafy greens, tomatoes, onions, garlic, peppers, and cruciferous vegetables like broccoli and cabbage. These foods supply dietary nitrates, antioxidants, potassium, magnesium, and fiber. Dietary nitrates are converted into nitric oxide through pathways that remain active even in older adults, helping arteries relax and improve blood flow. Nitric oxide deficiency is one of the major reasons arteries stiffen with age, so restoring it through food is biologically powerful. Fiber from vegetables plays a separate but equally important role by binding bile acids in the intestine, forcing the liver to use circulating cholesterol to produce more bile, gradually lowering LDL cholesterol without stressing the liver or muscles. Fiber also feeds beneficial gut bacteria, which produce short-chain fatty acids that reduce systemic inflammation, improve insulin sensitivity, and calm immune overactivity that damages artery walls. Legumes such as lentils, chickpeas, and beans are another cornerstone of this meal and are often underestimated by seniors. They provide plant-based protein without saturated fat, stabilize blood sugar, lower LDL cholesterol, and reduce post-meal glucose spikes that directly injure endothelial cells. Insulin resistance, which becomes more common with age, accelerates arterial damage, and legumes slow carbohydrate absorption, protecting arteries after meals. Studies show that replacing animal protein with legumes improves cholesterol profiles and inflammatory markers within weeks, even in older adults. Whole grains such as oats, barley, and brown rice further support arterial health by improving elasticity and reducing stiffness. Beta-glucans in oats lower LDL cholesterol and improve endothelial responsiveness, making arteries more flexible and better able to handle blood pressure changes. Fatty fish like sardines, mackerel, and salmon, while optional, provide omega-3 fatty acids that reduce triglycerides, suppress arterial inflammation, and stabilize plaque, making it less likely to rupture. Omega-3s do not unclog arteries directly, but they dramatically reduce the risk of sudden cardiac events by calming inflammation inside plaque. When these foods are combined into a single consistent meal pattern, they change the internal environment of the arteries. Inflammation decreases, oxidative stress drops, blood flow improves, and nitric oxide signaling strengthens. Over time, plaque becomes more stable and sometimes even slightly regresses in volume, as shown in imaging studies using coronary CT angiography. Importantly, arteries do not lose their ability to heal with age. They lose the signals required for repair, and this meal provides those signals daily. A practical example of this meal would include a large plate of mixed vegetables lightly cooked in extra virgin olive oil, a serving of lentils or chickpeas seasoned with herbs, a small portion of whole grains, optional fatty fish a few times per week, and fresh fruit instead of sugary desserts. There is no frying, no refined sugar, and no industrial seed oils. Consumed consistently, especially earlier in the day or as an early dinner, this type of meal has been shown to improve blood pressure, cholesterol balance, inflammatory markers, and vascular flexibility within months. It is important to understand what this meal does not do. It does not replace emergency medical care. It does not instantly reverse severe blockages, and it does not cancel out smoking, inactivity, or excessive alcohol use. However, it works in harmony with aging biology rather than against it. Seniors often benefit more than younger adults because older arteries are more sensitive to inflammatory reduction and endothelial repair, which is why studies frequently show dramatic risk reduction in older Mediterranean diet followers. Common mistakes seniors make include using refined vegetable oils instead of true extra virgin olive oil, consuming excessive bread and cheese while calling it Mediterranean, relying on supplements instead of whole foods, and eating heavy meals late at night, which increases overnight blood pressure and arterial stress. This meal pattern is safe alongside statins, blood pressure medications, and diabetes drugs, and many clinicians observe improved medication effectiveness when patients adopt it consistently. The larger truth is that arteries are living tissue, not dead pipes. They respond every day to what you eat, how inflamed your body is, how well you sleep, and how well blood vessels are supported. Aging does not eliminate this responsiveness, it amplifies it. That is why the most powerful artery protective intervention after 60 is not a new pill, but a consistent, anti inflammatory, plant forward meal centered on extra virgin olive oil and whole foods. Not because it is fashionable, not because it is ancient, but because it aligns precisely with human vascular biology. And that is why, from a scientific and clinical standpoint, this remains the number one evidence-backed meal to help arteries recover, stabilize, and function better over time.